Good evening and welcome to RFL. I'm Richard French. Thanks for starting this week with us. And we begin this week, much like we ended last week, with record numbers of COVID cases. The virus spreading fast in huge chunks of this country, including South Florida, as well as Houston, Texas.
We definitely had a sharp increase in the number of people going to the hospital. Number of people are in ICU and the number of people on our ventilators.
We have to acknowledge the fact that the numbers are continuing to rise.
Now, Florida has had more than 27,000 new cases in the past 24 hours, the most any state has seen over a two-day period at any point in this entire outbreak. And it is just one of the Sun Belt states that are getting hit particularly hard right now. The Southeast, it's seeing the biggest growth in cases. Midwest, not far behind. On this map, red and orange are bad. Blue and white are good, and as you can see, the bright red colors dominating the American map. All this is happening as the White House now going out of its way to try to, and I want you to think about this, in the middle of a pandemic, the White House is going after the CDC, criticizing the top infectious disease expert in this country, none other than Dr. Anthony Fauci. We'll discuss that in a minute with former HHS Secretary under President Obama, Kathleen Sebelius. But first, more on the pandemic. Fauci and every other doctor except those in the fringes saying testing, testing, testing. It is the key to fighting this virus and also trying, albeit late in the game, to get a handle on the spread. Now, using that as a gauge, this chart is really bad news. It shows that only a handful of states are doing enough testing deemed necessary to mitigate the spread. The sea of red shows the states that are falling short. Now, the outbreak, it is putting a huge strain on those hospitals. Advent Health, it runs 30 Florida hospitals, says ICU units, they're running at 90% capacity, and they don't expect the peak to hit until later this month. They have weeks more. Now, the state has been averaging more than 70,000 fatalities, 70 fatalities, I should say, per day. That for the past week. This ICU doctor in Florida getting choked up describing the scene that he's facing daily.
These aren't 80-year-olds that should die. These aren't 80-year-olds that were going to die next week. These are 80-year-olds that contracted a virus because a group of people just didn't want to wear a mask and they had to go out and have fun. And it really upsets me when everybody says it's just old people and it's not a big deal. I had a mom and grandmother drive themselves into my hospital, and only one drove home. It's really upsetting.
So what's going on in Florida right now shows that what Governor DeSantis said just a couple months ago has not aged well at all.
You look at some of the most draconian orders that have been issued in some of these states and compare Florida in terms of our hospitalizations. I mean, you go from DC, Maryland, New Jersey, New York, Connecticut, Massachusetts, Michigan, Indiana, Ohio, Illinois, you name it, Florida's done better. And I'm not criticizing those states, but everyone in the media was saying Florida was going to be like New York or Italy, and that has not happened.
No. They had more positive cases one day than New York ever did. That again, the Florida governor. Houston also has its hands full. Leaders of the biggest city in Texas, they would like a stay-at-home order for the next 2 weeks, but they don't have the authority to do that because the governor, Greg Abbott, has said if things get a lot worse, a lockdown would be needed, but that is a last resort. Don't know what he's waiting on. Statewide, Texas reported more than 8,000 new cases in the past day, 80 deaths, and a record 10,000 new hospitalizations. This doctor on the front lines in Houston describing what they may need to do to keep up with the surge in patients.
Now that we've got so many cases coming up, we may have to go to the next phase of opening up something like a stadium.
A stadium. Next door in Oklahoma, that state also reported record high numbers of cases as well as hospitalizations. And you may remember Tulsa. Well, that was the site of President Trump's rally a few weeks ago that everyone, including the medical experts there, begged him not to have. As you can see, almost no one had masks on, and it is now Tulsa that is seeing a spike in the number of people having tested positive. The head of Tulsa's health department says the Trump event likely contributed to that spike. And when it comes to protective gear, now we are hearing the same things that we heard back in April and May in New York. Doctors and nurses saying they are running out of things like masks and gowns, and ventilators are even becoming scarce in some places. Remember, We're in July, everyone. Who would have thought that was even a possibility? You go to California and Riverside, a group of nurses, they went out on strike saying they are understaffed and don't feel safe.
We should have the staff to care for every patient that walks through those doors. You know, the coronavirus is rising up again. They're closing the restaurants again. You know, we're gonna get hard once again. We need the proper PPEs. We need the proper staffing. If not, if the nurses get sick, who's gonna take care of us? Who's gonna take care of the patients? Who's gonna take care of your family members?
And now Governor Gavin Newsom, he's rolling back a lot of the reopenings by closing bars, indoor dining, gyms, and more in California for the hardest hit areas. And for more on the president declaring war on science and the scientists, I want to bring in Andrew Whitman, senior political correspondent. And I did a double take when I heard who the president was aligning himself with and who he was choosing to attack. When we are an outlier in this globe, certainly among westernized nations here. We have it worse than anyone in Europe and in parts of Asia, large chunks of it, and yet we're going after our scientists?
Facts are a stubborn thing, Rich. There's an old adage in politics, if you don't like the facts, question the facts. If the facts are beyond question, challenge the experts who present those facts. For months, the president and the White House, unable to contest the facts of the virus, have been isolating the experts. Last week, though, Dr. Anthony Fauci began gently pushing back on White House COVID positions without going out for any one person in particular. He did so on White House claims that lower death rates show progress.
It's a false narrative to take comfort in a lower rate of death. There's so many other things that are very dangerous and bad about this virus. Don't get yourself into false complacency.
Fauci did the same on the possibility that reopened states may have to shut down again.
Any state that is having a serious problem, that state should seriously look at shutting down.
Both contradictory to White House positions. So Thursday night, Trump spoke to Sean Hannity, targeting Fauci more than he had, seemed to target the virus.
The mortality rate, and Dr. Fauci's a nice man, but he's made a lot of mistakes. Like, you don't have to ban them coming in from very infected China. They've been wrong about a lot of things, including face masks. Maybe they're wrong, maybe not, but a lot of them said, don't wear a mask, don't wear a mask, and now they're saying wear a mask. So a lot of mistakes were made.
Then over the weekend, the White House went further, sending a dossier with discrediting information about Fauci to the press, pointing out Fauci said things like, Americans don't need to make day-to-day changes about COVID back in February. He also said that might change, but the White House didn't disclose that part of the quote, and they revealed Fauci is sometimes referred to in the White House as Dr. Doom and Gloom. And just to make sure we all talked about it, this morning Trump tweeted or retweeted Chuck Woolery, who's now a conservative radio host, as Woolery questioned the CDC, doctors, Democrats, and the media, saying everyone is lying to kill the economy and the election for Trump. Woolery had a 2-2, also claiming that science demands that schools reopen. Trump retweeted that one as well. In response, Democrats accused the president of prioritizing his own political future over public health.
Dr. Fauci is the most respected voice in the country on how we ought to be dealing with this pandemic. And to be trying to sideline him or diminish him or discredit him is just atrocious.
The denial of reality was to deny science. And he's done that from day one. At the end of the day, science trumps politics. Politics does not trump science.
Cuomo also called the coronavirus a scandal bigger than Watergate. Trump's opponent this fall tweeted simply, Donald Trump needs to spend less time playing golf and more time listening to experts like Dr. Fauci. That from Joe Biden. Rich?
Andrew, thank you very much. I want to bring in our guest, Kathleen Sebelius. She's former HHS secretary in the Obama administration, also former governor of Kansas. Madam Secretary, I knew my day was getting off to a bad start when one of my younger daughters asked me who Chuck Woolery was, and I said, why do you want to know anything about the former host of The Love Connection? And apparently, she says the president is using him as a resource more than Dr. Fauci. Sometimes, I don't know where we try and find reality anymore, but just how concerning more than disturbing is it that the president is saying not to trust Fauci, but to trust conspiracy theories about hidden agendas at the CDC?
Well, I find it pretty frightening. Anthony Fauci, I had the pleasure and honor of working with for 5.5 years. And he's a world-renowned scientist. In fact, everybody across the globe wants Tony Fauci to come and help them with vaccines, help advise their public health officials. The idea that President Trump, in the midst of a pandemic, in the country that is doing the worst possible job in controlling the virus, would seek to undercut the credibility of our top public health official working on the vaccine is horrifying, and it will be incredibly dangerous. The last thing we need, Richard, as we look forward to a possible vaccine, is for people not to trust the information coming out of the public health community, to not think it's safe, to not want to be vaccinated, because if that happens, we will never get rid of coronavirus in this country until 90% of the population has it. I don't have any idea what the White House is thinking.
How is this supposed to work? And God forbid this happened when you were in Washington. I ask that because today the two biggest school districts in California just said that they're going to do online only in the fall. And you have school districts, large and small, across this country, basically being told you're on your own. And if you don't capitulate and open the way that we want you to, in effect, you know, there'll be extortion on their end. We'll cut off federal funding at the very time that state revenues obviously have fallen off a cliff. Who should be in the room together every day, multiple times, and giving a coherent message to the American public, whether they're red or blue states? I mean, I don't know why that matters, but talk about it in a normal world, how it would work.
Well, you're absolutely right. This is not normal at all. We were fortunate to work for a president who believed that in the case of a pandemic, you lead with the science and you only listen to the science. Scientists get things wrong periodically, and they'll immediately correct themselves and now tell you what they're learning. This is a novel virus, and what we've had over and over and over again is the politicians, the White House, try to overrule science, sideline science, get rid of people allowed to speak because they want a different message. I just want to give you just a snapshot, which I find to be particularly terrifying. On April the 16th, which seems like a long time ago, but April the 16th, CDC put out guidelines of how businesses should reopen in states, how safe it was. 3 different phases, each one with 14 days in between, starting from the fact that you needed 2 weeks of downward disease trend before you even got to phase 1. The following day, the next day, the President of the United States said, pay no attention to that. Liberate Michigan, liberate Minnesota, liberate Virginia, open up businesses right away. We've got to get back to the economy. This is 12 weeks later. 12 weeks later, we have the president doing this again about schools. We now have had millions of cases. We're up to 3.2, 3.3 million cases, and we have 132,000 people who died. He was wrong then. He's wrong now.
You know, I'm curious. I put you back in Topeka. You're a governor. Do you feel abandoned right now where you're getting competing messages depending on the platform? Your public is looking for a coherent message, but your education secretary hasn't had one conversation with your school superintendents. The federal government's going against what the CDC says, and funding is being threatened to cut off, even though you're having to make your budgets, and as I said before, your revenues are nowhere to be found. Do you feel, if you're a governor right now, I don't care your party, as if your federal government's abandoned you?
Well, absolutely. There are unique roles that the federal government has, and one is safety and security of the American people. They have unique purchasing powers. They have unique logistical powers. They can give a message out of the White House that a governor, try as he or she might, cannot deliver. The people will not listen in the same way as the President of the United States. So not only are states told they're on their own, but in this situation, there is no additional funding. If you think about reopening schools in 8 weeks, Labor Day is 8 weeks from now, think about reopening schools. Schools need additional funding. They need more personnel if they're going to break kids into smaller groups. They need more space than they've had. They need more cleaning crews. They need personal protective equipment. They need a plan for if we open, how do we shut down again? What is the measurement that we should use? Those conversations should have been going on months ago. They're still not going on today. The only thing that's happening today from the White House is a threat that we will cut off your funding. The same day that the president suggested he would cut federal funding for K through 12 schools, also ICE, the immigration authority, threatened colleges, if you don't open on-campus classes, we will deport all of your international students. It isn't coincidental that that all happened at the same time.
You know, a few months ago, finally, I thought I knew how this ended. Nobody knew the exact dates or, you know, what the final number, God forbid, of the positive cases, let alone fatalities were. But you looked around the world and you said, okay, I've seen what happened in Asia. I've seen what happened in Europe. I get it. I don't know. Do you? How this now ends? Because we know there'll be a second spike, but the idea that we don't have enough PPE in the middle of July or ventilators, and again, the president doesn't want to seem to talk about this. This is a frightening kind of forecast for what our fall and winter are going to look like, and that's crossing fingers that this vaccine comes through and that people actually all take the vaccine. I can't believe in July we're having this conversation, but I don't think it's alarmist to say we just don't know how bad this thing could still get.
Well, we're seeing numbers that nobody has seen anywhere in the world, and we are setting an example that nobody has followed. So we don't have any place to look. I hear the president talking about other countries have safely opened schools. Other countries, first of all, got their disease burden way down. They were well equipped to begin contact tracing and testing as soon as disease outbreak began. And they've really staggered. A couple of the countries like Israel opened schools, took down the barriers right away. They're shutting schools down again. But we have never gotten a handle on the first wave of coronavirus. The states that are spiking now, this is the first wave through. We could continue at this level, moving this disease from state to state. And when flu season hits, when it gets cold, when people are really forced inside, then we will have an even greater explosion of disease. So we have to do some very dramatic things. And all this president wants to talk about is business as usual. Pretend this will go away. Pretend it's not happening. And if people in the scientific community don't agree with him, he's moving them aside. He's muzzling them and firing them. And unfortunately, that gives no confidence to the American public, to business owners, to teachers and parents, to everyday people, that they have any information that they can rely on and that they should go about their normal lives.
Well, I always appreciate you giving us a few minutes. Secretary, thank you so much.
Glad to be with you.
All right, everyone, when we come back, despite the outbreak and how fast COVID is spreading, the president and his education secretary, as you heard, are pushing to send the kids back in school full-time this fall, even though there is no, and I stress the word no, national plan to ensure our kids' safety. Stay with us.